Greetings to you today as we continue our discussion on Dr. Gerald's Healthline. Today we're looking at the continuation of our series on fractures of the upper limb, looking specifically at the humerus. Now, here you have a bone, okay? This is a representation of what the bone looks like. This is the humerus. Now that's the head of the humerus. This is the neck. This is the shaft. And then lower down here, I want you to take very important note is this is the supracondylar region. That's the medial condyle, the lateral condyle, and then that's the part that forms the elbow. Now, any of these parts of this bone can be fractured, and when it's broken, the individual can come down with any of the symptoms we described. Now, when the fracture occurs around here, okay, which is called the surgical neck of the humerus, there are important structures that run around here. All right, there is a vessel, that's the circumflex humeral artery, and the axillary nerve. Now, these two, if injured, can result in the person having numbness or losing sensation on that part of the hand. And so you may have one of the clinical features why the person will present to the hospital, apart from the pain, that you're also having some feeling of abnormal sensation in the upper limb. Now, once the fracture occurs around here, it can be treated both operatively, that is by doing surgery, or non-operatively. Okay, so the surgeon, the orthopedic surgeon who sees you, will be able to ascertain which one will be most beneficial for you. Sometimes we value the fact that you may need to have function in your shoulder joint, so we want to do what we do fast so that you can start moving the shoulder so that the shoulder joint does not become stiff. All right, so you have to bear that in mind as you approach your doctor. Now, fractures that occur around the shaft, okay, is also one of those that can increase the risk of injury to a very important nerve, which is called the radial nerve. The radial nerve is what is responsible for some movements in the hand, like making the extension movement around the wrist. So once there is a fracture here and it affects that nerve, because that nerve runs usually in the groove, okay, and it's usually accompanied by a vessel, okay, and if they are injured, it will result in that person coming down with that abnormal movement, okay, loss of the ability to extend the wrist, and so you see there's a wrist drop. Now, once you have that, sometimes your surgeon can choose to do surgery so that you can explore and find out what happened to the nerve. In line of fixing the fracture can be fixed by putting a plate right on top, or it can be fixed by putting a nail into the bone. Now, whichever one they choose, it is safe and it can lead to good outcome. So I want you to make sure that you make the right decision, ask the right questions to get the right results. So do not be afraid. If you've got a fracture affecting the humerus, approach the orthopedic surgeons, ask questions, and let it be fixed. Not all cases will require surgery. And when surgery is required, then go ahead. It can be safe and it can be done properly for you. And you don't feel, you can always write into us, send us your x-rays, and we'll be able to advise you appropriately for you to take the right decision to get the right outcome. I want to say thank you for tuning in once again. We will be seeing you as we discuss further on the other fracture types in the humerus. See you again soon. Bye.